Hi, everybody. I have the honor of presenting Emma Dobbins for her SFPC graduation today. And to start, I'm going to roll it back a little bit. Some of you may not know that Emma went to Carleton College before she came to us in medicine, and she studied political science. She played soccer there as well as Division I Ultimate Frisbee, little known fact, and was the coach and captain of the team. She almost went to law school. And after college, she worked as a case manager for a mobile clinic for people experiencing homelessness. And it was there that she discovered her natural talent for building relationships with patients and for addressing health disparities. She came to UCSF for medical school. She, along the way, got a master's at UC Berkeley, writing her Master's of Science thesis on a qualitative study of single-site housing first program in San Francisco. And throughout, and I got to review her ERAS application in preparation for this, there's just a thread of teaching, of immersing, of just full-on passion for improving systems for people experiencing homelessness and for marginalized communities in the Bay Area. And Emma has volunteered or touched or worked somehow at nearly every organization and program and free clinic in the Bay Area that I can think of. So she was a natural fit for SFPC. And when she was accepted, Joni, the program director, had a very new experience with a resident. When she called Emma to tell her that she was accepted to SFPC, Emma said she was having a baby in 2 months, but she wanted to start residency very soon. And Joni luckily convinced her to take some time. Fast forward to residency, and Emma has been a thriving member of the SFPC community. First, I'll sort of talk about her as a resident. When I ask people about what kind of resident and physician Emma has been, and what kind of person she's been throughout residency, there was one word that was continually used by everybody, and that word was grace. Emma has gracefully navigated being a physician and a resident and a mother in residency in a way that most of us have trouble fully understanding. It's not easy to do it all, and Emma has really done it with grace and has really kept it all together. She's a careful and detail-oriented physician. She, and these are people's words, she goes out of her way to advocate on a social level for her patients. She brings a high energy. Her evaluations in both inpatient and outpatient are glowing. She's clearly a natural generalist, and she thrives in all sorts of different clinical settings. She has a unique talent for really meeting patients where they are, and really early on was able to recognize this and was unusually good at knowing how not to pressure patients to make change no matter what. And not only has she been this type of fantastic clinician who's balanced, but she has been an amazing member of the SFPC family, as you see here in these pictures. Her kid, Jude, is apparently the SFPC mascot. She's loved not only by Emma, but by all of her co-residents. In fact, there were more pictures of this baby with Sam Lee than with Emma. And I love this picture of Kala, who has also joined Emma's family during residency. And during residency, Emma has been figuring out what kind of doctor she wants to be. She's been on a journey, as have all of her co-residents, and she's grown with confidence. And I want to wind back to 2 goals that she actually stated in her personal statement in her ERAS application for residency. And the first was that she would help the field of medicine to think creatively about how to address the structural determinants of health by incorporating a systems perspective into medical education and clinical practice. And talking to people about how Emma has done in residency shows that she has met this goal, and she's really thrived, not only in taking care of patients, but in teaching others. And she'll continue to improve our systems level care of patients in need by working as a hospitalist in the East Bay and really taking on transitions of care and a broad scope of practice. Her second goal was to provide kind, evidence-based primary care to people of all ages and backgrounds. Emma, you are leaving behind a panel of patients who can attest to how you have met this second goal. So thank you. Emma has held during residency not only this accomplishment of getting to the finish line for herself, but really for her whole family. Through a COVID pandemic, she held gracefully, being able to come home to a little kid and a large family, even in times that were really scary. And so I know that this accomplishment is not only for you, but for your family, for your husband, Sam, your kid, Jude, your sister, Sarah, and your entire village. So thank you, Emma. Congratulations from your entire SFPC family.